Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Harvey Castro, emergency medicine physician and healthcare consultant. Today's Kevin MD article is ChatGPT Health in Hospitals, 5 Essential Safety Protocols. Harvey, welcome back to the show.
Thanks for having me, buddy.
All right, so let's talk about your latest article about ChatGPT Health. It's been all over the news. What's this one about and what led you to write it?
Yeah, so big picture, back in the year 22, I wrote the first book. How do we use this thing called ChatGPT in healthcare? And I chuckle now because everybody knows what that is.
Yeah.
And the more and more I study this, the more and more I realize, hey, governance and the right way of doing this is crucial. Because if we get it wrong, there's too much at stake. It's not like we pick a bad stock because AI told us to buy that stock. Like literally, people can die.
So, ChatGPT Health, for those who aren't familiar with it, it was recently introduced within the last few months. What exactly is it in 30 seconds?
Yeah, in 30 seconds, kind of interesting. Basically, your ChatGPT algorithm now allows you to upload your wearables, your Apple information, health, and then as a result, you can go through and go back and forth with the chat and say, hey, my hemoglobin A1C is X. What does that mean?
Yeah.
And so for non-physicians, it's helpful, but at the same time, for us physicians, it kind of gives us a little scariness because is this correct? Is this hallucinating? What's happening here?
So basically, patients can upload so much of their personal data. You mentioned things like Apple Watches, but also their entire health record as well. And then they could use ChatGPT to query it and ask it any information. That's correct?
Correct. Yeah. And it's kind of scary because you don't know what's in your medical records that time, right?
Yeah.
Most patients, they think they know, but they really don't know what's all in there. And for it to give that information up to ChatGPT from a privacy point of view, that's a flag. And then the second is, even if you're okay with that, what if it misinterprets what's there? And as
Yeah.
we know, medical records has so many errors in it already.
So from the hospital standpoint, what are some of the red flags that they need to be careful of as more and more patients use ChatGPT Health?
Yeah. So I broke it down into 5 pillars in the article. I invite everybody to make sure they read it. The first one, obviously, is the data privacy. If we get this one wrong, it's game over. If your patients don't trust us, you know they're not coming back. And so we must make sure that obviously it's HIPAA compliant, obviously that it's encrypted, but not only that the information is safe, every time we move the data, is the data safe as well? Meaning, if the nurse is saying the hospital system, the AI is going slow, and she's like, oh, I'm just going to use my phone and use my public AI account, obviously we can't do that. But there's people that say, you know what, it's going to be okay. The answer is no. We need to make
Mhm.
sure we do this correctly.
Now, in terms of the privacy risks from the patient standpoint, what are some of the things that they need to look out for? ChatGPT Health encourages patients to upload all this health data there. What are some of the privacy safeguards with that tool?
Well, number one, obviously, they're going to make sure that that platform is HIPAA compliant, meaning there's no person out there that's trying to hack into that bridge of you connecting up to ChatGPT, make sure they're not taking your data. So that's obviously number one. Number two, that other data sets in the sense that when your encryption going back and forth is connected. And then the other thing is on their side that their servers, you're actually at the mercy of their servers. We've heard it multiple times in the news saying, oh, Aetna or this company or that one got hacked. How can we make sure that ChatGPT doesn't get hacked? Because you know that they're taking that information.
Now, is that happening? Are we confident in the security of patient privacy from the ChatGPT perspective?
Ooh, that's a tough question. I would imagine with the billions of dollars at stake that they're doing everything possible, but at the end of the day, we all know that nothing's 100%. I haven't read anything that they've been hacked, but I would imagine that there's tons of people out there lining up trying to break that.
And again, going back to the hospital standpoint, do they have to take any specific measures above what they're already doing as more and more patients are using AI and using ChatGPT Health to analyze their data?
You see, that's a really good question. Number one is the diversity in the data itself, right? The hospital just can't say, hey, Harvey just came in and is trying to sell us this product. No, let's look at the data. Does that data represent the population that that hospital is serving? So that's a really important question that the hospital must look at. Other things that they must also look at is when we're using the AI model and the geeky side, we call it the data drift, meaning I'm asking it questions every day and it's doing what I meant it to ask. But with time, the model will drift to a certain point where it stops doing that. So we need to, what I'm adding now is we need to make sure that the hospital administrators know that we must have a data scientist in the loop to make sure that it's checking the data, to make sure that the data looks good and the model hasn't changed or drifted to something that it wasn't meant to be.
Now, today, just give us an update. This episode will go out probably sometime in March. How are hospitals and health systems currently using large language models? What's the state of the art?
That's a good question. The nice thing is we're seeing the bell curve. Hospital systems that have a little bit more resources are definitely leveraging AI to the point where they're bringing models in-house, training the data of their patients in their hospital system, making sure that it's secure. But second, they're able to use this data for predictive analytics, for different portions of like radiology, finding there's different studies that has been showing, like for example, the human can see certain things, but the AI is able to not get tired and see certain patterns that we may miss or
Hmm.
because we're tired. And so the hospital systems are adding this as part of their protocols. What I find fascinating is we're starting to see a two divide system where hospitals are going real strong with AI, doing it correctly, doing the governance, but then we're seeing the other side where they have no idea or they don't have the resources to be able to get that.
So, those hospitals that don't have those resources, are they just using these commercial models? Are they just being more lax with security and compliance? What are these lower resource hospitals doing?
Unfortunately, they are just trying to keep their doors open. So a lot of times they're not even adding the extra expense because they can't afford it. And I totally understand that point of view. And so what I foresee happening is this is my biased opinion. I foresee the bigger hospitals, stronger, healthier, coming in and taking over the other hospitals that don't have those resources, and then get using that as a competitive advantage to possibly close those other hospitals or just take over them, which is, I know the last thing we want to hear as a doctor is that we're closing hospitals.
Now, as we both know, a lot of these health AI startups, they're selling their products to these hospitals. Now, as hospitals evaluate these tools, you mentioned your framework, but let's go into more detail. What are some of the questions they need to ask these new companies to ensure that not only their tools are compliant, but effective as well?
Yeah. So number one, the data. Is the data junk data? Is it correct? I'll give you a quick example. I was in Europe giving a talk in dermatology, and it dawned on me. It's like, wait a second. When I went to med school, all the books that I read, all the populations was a certain type of population, and I hadn't seen rashes in different populations.
Mhm.
Same analogy. So ask the vendor, hey, let's look at the data set. Is this representative of my data? And if it isn't, how are you making sure that it is? And then as I start feeding it, is there someone in the company that's going to be in your side on the AI side that's going to check for that model drift that I'm talking about? Because most of the times they're going to sell it to you, they're going to walk away, and then it changes for what you spent all this money on and it's not there. And so obviously on the internal side, can we handle the electricity bandwidth? A lot of people
Mhm.
don't think about that, but we are using AI. We are going to start using more electricity. And if it is true that some of the hospitals are just barely making it, can we expend that much more money and energy?
Now, I was reading an article that a lot of these AI companies, because it's so easy to code, to vibe code, so to speak, that they're coming up with all these products, but they don't have any physician or clinician looking at how this product would really impact hospitals. So now hospitals are just inundated with a lot of these vendors that really have no basis in terms of how medicine is really practiced. Are you finding something similar through your observations?
Yeah, totally agree with you. And that's why I say it takes a village. It takes people like you, me. But the funny thing is, when I talk, consult startups, I ask them, do you have a patient as part of your board? And they're like, no. I said, do you have a doctor on the board? They're like, no. And I'm thinking, oh my gosh, they have part of the ecosystem and they're trying to create a solution, but they don't have the full team to represent that solution. And so, obviously, to your point, we need to make sure that we have the doctor in the loop, the patient in the loop, but not just the doctor, the whole staff. Because as you know, the team, how many times has our nurses saved us from X or Y,
Yeah,
or the
yeah.
front desk said, hey, doc, did they tell you X? She was like, whoa, I didn't even know that. So, we need everybody included.
Now, for these health IT companies that you consult with, so when you say, hey, you need a patient, you need a clinician in the loop, do they actually listen to you and make those changes?
Actually, they do. We've been able to successfully create certain boards for this, and I've been able to look at the model and look at their framework and how they're doing it. At the end of the day, my personal goal is the patient safety. And I have to add this because I want to make sure we get this in there. We got to make sure that our hospital systems are transparent with their policies so that if AI is being used, our
Mhm.
patients know that it's being used. And I know that sounds like, oh no, they just registered. No, no, no. We need to be transparent because again, it's all about trust. If we lose this trust in this fight of AI and healthcare, we're going to lose this battle and
Now,
war.
now, from the patient standpoint, what are some common scenarios where AI may be used that they may not initially be aware of?
You know, I'm kind of lax on this department, but I hope patients realize, even down to your appointment now, a lot of that information now it's creating, it's looking for a slot and giving you that information. There's more and more models that, as we know, the ambient listening, a lot of hospital systems are using that. And for better or worse, depending which side you're on, you want to make sure that it's transparent so everybody knows. And then on that side, I really think we need to educate both sides, the physician and hospital side, but the patient side of how this tool is being used. And then I know this is very controversial, but we should give an opt-out button. If the patient's like, look, I don't want this AI as part of my healthcare, we need to be respectful of that and say, you know what, that's fine. Just know that this is the different framework when we're working with you.
Oh, it's so interesting. So, do you ever see a point where hospitals are going to be so intertwined with AI that if patients opt out of that, that hospital system simply can't serve them appropriately?
Yes, unfortunately, I see that day coming. I see a day that patients, like you said, it's going to be everywhere. It's going to be in our appointments, predictive analytics, in our X-rays, imaging, labs, in our EMR. It gets to a point where, and that's why I say at the end of the day, it's education. Let's educate the patients on the good, the bad, the unknown. That way they understand this product. That way they don't fear the unknown and they're more likely to accept it.
So, as part of your framework, you talk about human in the loop as hospitals adopt some of these AI tools. What would that look like?
Yeah, great question. So, for example, not many people don't know this, but the first ChatGPT 3.5 that came out, third world countries were saying yes or no to the output, meaning they were not doctors. There were some other countries saying, yeah, this looks like something right. And then people are using that data. So the human in the loop, the reason that's so important is not just any human, it's a doctor, and not just any doctor. If you're asking an ER question, then make sure you have an ER doctor in the loop,
Mhm.
meaning if it hallucinates, if it makes an error, if it's saying something that is totally off, or if the guidelines have changed. Example, if AI was built until a certain date and the guideline came out on that day, but a day after new guideline came out, the AI has no idea. It's technically correct,
Mhm.
but it's no longer accurate. That's where the human comes in and looks at it and it's like, no, 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 this is wrong. And that's why we need to have that.
And the evaluation of these tools doesn't just stop once a hospital adopts them. There needs to be continuous monitoring after adoption as well. So talk more about that.
Yeah, we need to make sure that thing that I mentioned earlier about the data drift, that make sure that we have someone auditing it, and then make sure that it's a 360 again, so that the patients can say, you know what, that seems off, or the doctor, or the front office. That way, the data scientist is able to get that information and look at it and say, oh yeah, this is drifting. But more importantly, hopefully the data scientist that's working in this saying, wait, the model is shifting. We need to pause it for a minute. Let us fix this before we use it anymore. So that is really, really important. Make sure that it's tracking the trends, make sure that it's accepting the clinical feedback, and obviously making sure that we're doing regular audits on the system.
Now, you're consulting a lot of healthcare institutions, of course, regarding AI adoption. What are you seeing? Are the majority of these medical institutions adhering to this framework that we're talking about today?
Yeah, I see it happening. What fascinates me is I'm getting a lot of calls from the Middle East, from Singapore, and they're doing things way differently. And I think it comes down to politics.
Hmm.
If it's pushing down from the government down, saying, hey, one electronic medical record, one data set, one AI, things are going to happen. Here in the United States, we got fragmentation, we got lobbyists, we got different points of view, so things are a little bit slower. So I find it really interesting. I hate making prediction, but I predict we're going to start seeing some really interesting models outside of the US and the use of it outside. Example, Middle East is using digital twins. I'm like, oh my gosh, being able to have your own digital twin and practice medicine and what drugs work and whatnot, and then tell the patient, okay, this is the drug that I know is going to work best for you. And I'm thinking, I'm getting a little FOMO. I was like, I want to have that here in the United States.
We're talking to Harvey Castro, emergency department physician, healthcare consultant. Today's Kevin MD article is ChatGPT Health in Hospitals, 5 Essential Safety Protocols. Harvey, let's end with some take-home messages they want to leave with the Kevin MD audience.
Yeah, at the end of the day, think of AI like riding a bike. When you first started riding a bike, you were scared. You were like, I'm going to fall. And before you knew it, you started probably texting and riding your bike or not using your hands. Same thing with AI. Use the tool, know the good, the bad, the ugly, and the more you use it, the more you'll realize how more efficient I can be and how I can help my patients more importantly. And thank you so much for coming.
Harvey, thank you again for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you.